Good morning, everyone. We are the group for mitochondrias, and we are gonna discuss our answers for Activity 2 Philippine Healthcare Delivery System. We are tasked to watch the videos pertaining to the healthcare delivery system here in the Philippines. And these are the following questions. What are the immediate healthcare needs of our community, our country, and the world as a whole? What are the pressing issues in our society that have a great impact on our healthcare system? What issues or needs in the healthcare system will the UHC law address? Lastly, if you will be given a chance to be in a position where you can implement change and pose solutions to our healthcare issues and needs, what would it be and why? What are the immediate healthcare needs of our community, our country, and the world as a whole? These are our shared answers to the question. Everyone deserves the best care possible, right in their own community and even the world. This is the central tenet of primary healthcare. Primary healthcare handles the vast majority of a person's health requirements over the course of their life. Through this, we could cater the needs of the community, most especially the world. This covers physical, emotional, and social well-being, and it is focused on individuals rather than diseases.
Moreover, PHC is a comprehensive approach to health that encompasses many services such as health promotion, illness prevention, treatment, rehabilitation, and palliative care. Through this access to PHC and their services, we could cater the needs of the people in terms of prevention and education to achieve better health outcomes such as improvements in self-rated health and reduction in all-cause mortality. This means that the accessible healthcare through the primary healthcare services could address and help lessen health-related problems and even death rates in a community or even in a global scale.
On the other hand, structural and functional changes in health financing, service delivery, and governance, as well as expansion in financial protection and access to health services to all Filipinos, are the immediate healthcare needs because Filipinos continue to suffer heavy financial burden from health spending.
Based on your observations in the video, what are the pressing issues in our society that has a great impact on our healthcare system?
We have observed that there are several pressing issues in our society that has made a great impact on our healthcare system. One of them is the lack of access to health services, which happens because of the socio-economic background of some people and at the same time poverty. This happens because of the lack of education or awareness due to poor governance and support, which prevents the community from having a full access of health services. This also explains why many individuals from low socioeconomic backgrounds are more likely to take their health for granted.
Aside from the difficulty of healthcare access, the lack of funds and support from the government also lessen the effectiveness of the country's healthcare system. Having this poor governance and system has resulted in errors, poor quality of service, and discontent among patients and health workers. For an instance, the Philippine market for medical products lacks effective government coordination and control, and its inefficiency has led to uniquely high drug prices.
It has been mentioned in the video that healthcare workers are considered to be supported by having budget or funds allocated to provide a better healthcare system. Since not everything is cost-effective, having more funds could help our healthcare system to impose more programs and organizations to help cater the needs of our community. With enough funds, it could help to solve the gap between our communities' access to health services and financial and reliable support.
What issues or needs in the healthcare system does the Universal Healthcare Law address?
The Universal Healthcare Law is a law that guarantees equitable access of Filipinos to quality and affordable healthcare goods and services. In essence, this law disregards the financial status of an individual as a social determinant to his or her rightful acquisition of healthcare. The Universal Healthcare Law targets to increase the capacities of system delivery and contribute to the healthcare provider network, which will address the fragmented health system and service delivery in the Philippines. The UHC law will also reorganize health systems within the local levels and assist in the active engagement of the LGUs with regards to health promotion, namely campaigns, vaccinations, cleanliness and sanitation, and other preventive measures to effectively manage the local health systems. Moreover, the law will also initiate the assessment of health technology and the needs of health information systems all over the country, as well as further enhance drug rehabilitation, mental health care, and cancer control law. Furthermore, the people will be protected from financial risk through national health insurance programs and the establishment of a Health Technology Assessment Council to ensure that the most affordable commodities will be purchased by the government.
Lastly, if you will be given a chance to be in a position where you can implement change and pose solutions to our healthcare issues or needs, what would it be and why? In this juncture, each of my team members will share their own opinions or answers regarding the question.
The gaps in healthcare services are prevalent in the Philippines due to poverty. Filipinos are pushed into indigence because of the costs associated with health services. This issue can be addressed by enabling people to have easy accessibility to health services for the improvement of financial protection. I believe that the government should invest more on funding the different healthcare services to ensure the active assistance to the health of the Filipinos. Also, investment in health technology systems could further improve the healthcare in the Philippines and modernize it to the point where it could substantially propel greater change within our health information system.
If I were given a chance to implement something, I would implement various solutions to assist those individuals from low socioeconomic background to improve their living conditions by connecting and collaborating with other organizations that have the same goals as mine, which is to help those in need, as well as educating individuals by spreading basic health awareness on how to take care of their health. And I will also do my best to ensure that everyone has access to high-quality healthcare. Moreover, I'd like to create a program that encourages individuals to volunteer in the barrios in order to improve healthcare in those underserved areas. Above all, I also want to compensate the healthcare workers for their hard work and increase their salaries so that they are motivated to work and serve humanity.
According to the WHO, the Filipino healthcare system is fragmented, with a history of unjust and uneven access to health services that disproportionately impacts the poor. The government invests little money in the program, resulting in significant out-of-pocket expenses and widening the divide between affluent and poor. If given the opportunity, I would like to propose additional human medical resources, particularly physicians, because healthcare in the Philippines is in scarcity. Also, investing in technology systems that can improve the healthcare system, allowing it to run faster and more efficiently.
Here in the Philippines, rich or wealthy people are being prioritized, while those poor people who really need immediate healthcare are neglected. If I will be given the chance to implement a solution in our healthcare issues, that will be the poor will also be prioritized. Because we are all equal, we all need to receive proper healthcare. Whether you are poor or rich, no one should be left behind.
Okay, and those were the articulate answers of our crew. And that concludes our report about the Philippine healthcare delivery system. Thank you!